Hello, everybody. My name is Tyler Owens, and I'm the Program Associate for Rural Assembly. Thank you so much to Eliza Blue for participating in our Everywhere program. And up next, we have Indian Country's response to COVID. Today, our moderator is going to be Maria Givens, who comes from the Coeur d'Alene tribe in northern Idaho. Currently, Ms. Givens serves as a Communications and Public Relations Director for the Native American Agriculture Fund. Prior to joining NAAF, she worked as a freelance writer reporting on tribal political issues and native food systems, publishing pieces in Vox, The Daily Yonder, and Civil Eats. She graduated from the University of Colorado in 2019 with the Masters of the Environment and specializes in sustainable food systems. Ladies and gentlemen, I would now like to turn it over to Maria Givens.
Welcome, everyone. My name is Maria Givens. I'm a member of the Coeur d'Alene tribe in northern Idaho, and I'll be the moderator for today's panel. So I'd like to have our panelists introduce themselves. So Chairman Amber Torres, would you mind introducing yourselves for this panel?
Certainly. Pijo Wamawa, ni Amber Torres, minania no agarikara puenavina agaigwe. So good morning, everyone. My name is Amber Torres. I'm the chairman for the Walker River Paiute tribe located here in Schurz, Nevada. Thank you for having me.
Thank you. Candelarian, would you mind introducing yourself?
Sure, thank you. Good morning, everyone. My name is Candelarian Preston. I am the director for the Gila River Tribal Health Department. I'm also a community member of Gila River Indian community as well. Thank you.
And last but not least, Chandine.
Oh, yeah, it's Shikada Shidina, yeah, it's Arnold. So Shiakia Ani Adona initially Goldal Bashis Jean, Twitter Cheatney, Edasha Chase, Kabahan, Edashamela, Aquas Alstan initially, Shia Shandine Parish Unishia, Twitter Nesha, Den Nasha, Natas Aunt Danto, then I hooked to Dan Chishika Adol, Shamato Shaja, Shelly Parish, Do TJ BK William, but Klaja A Nakish, Deja Dosha Telehamo, Adosha A Nabaho, bitch Eka initially. Hello, everyone. My name is Shandine Parrish, and I am Miss Navajo Nation 2019-2021. And I am so excited to be here to share my experience during this tragic time. But, you know, I'm also very, very thrilled to learn everybody's stories and how Arizona has overcome this pandemic. Thank you.
Great. Lemlench, thank you. So the purpose of this panel is to really explore how tribes and tribal communities have approached the pandemic, and so many of our approaches have actually been nation-leading approaches to battling this pandemic, from small tribal governments showing how local governments can really instate some community-wide public health protocols to vaccination efforts, really understanding how Indian health can play a really critical part in our community health in this pandemic, and also understanding how this has impacted us culturally. So I'd really like to jump in first with Chairman Torres. Would you mind describing what the unique challenges have been for your community in responding to the pandemic?
Definitely. Thank you for the question. You know, when this very first started, we were trying to get versed on exactly what this was and what this entailed for our tribal government as well as our tribal community. I think, you know, some of the biggest barriers that hit us is we are a food desert. We are located 40 miles from your nearest grocery store, 2 hours from your nearest, you know, big grocery store such as a Costco. We have a small outpatient ambulatory facility that's almost 100 years old here on the reservation, where we service direct care to our community. And, you know, again, just being so rural and also managing 325,000 acres on our reservation, it was a big challenge. And having a small staff where everybody already wears 12 hats was going to be the biggest thing on how do we do this. Limited funding, you know, we're not a big casino tribe. We solely rely on grants. And so, you know, the biggest challenge was, what is this? How do we manage it? And what do we need to do? But I think, you know, we always show as Native people our resilience and how we come together to to manage anything, and especially in times of crisis. So thank you for the question.
Great, thank you. Sean Dean, you come from the Navajo Nation, and there's been a lot of media coverage about your tribe. Your Navajo is the largest tribe in the country and has faced a lot of unique challenges through the pandemic. Would you mind sharing with us how your community has faced the last year?
Wow, I can't believe it's been a year. We were just doing a food distribution yesterday, so I've really lost track of time because our focus has been solely on our people and our people's needs. And that's what I think is really unique about my position as Miss Navajo Nation. In my role as Miss Navajo Nation, I actually serve in a official governmental capacity through the executive branch, and I serve under the president of the Navajo Nation, and I've been very fortunate to follow in his leadership. And so I've been viewing how we've been able to mitigate the situation through a very direct government role, and also I've been very fortunate to be on the ground with our people. So on the Navajo Nation, we declared the public health emergency. We declared COVID-19 a public health emergency on March 11th, and we took large steps in closing down 50% of our executive branch 2 days later. And I remember being in the room at that time that our president made those decisions. And we didn't have a positive case at that time. And little would we come to find out is that we would get our first case within 11 days after that time. So during the first stages of COVID-19 on the Navajo Nation, nobody told me how to help and assist our government. So I really took a natural initiative to apply my prior work experience with the Arizona state government. I worked at the Arizona State Senate for 3 years. I also worked for the Arizona State Treasurer. And using that information and how governments work together really helped me in my time in volunteering my prior work experience and my expertise to the Public Information Office of the Navajo Nation, and translating a lot of our information from English to Navajo, because we have a huge population that primarily speaks Navajo here on our reservation. So translating and trying to get that information out to our elders who don't have electricity and don't have running water and don't have internet was crucial during the first stages of the COVID-19 pandemic. And I felt that, I was really put in this position to use all of my abilities to the best of however I knew how to. And at that time, it was really taking everything that I knew and just diving into serving our people. So that was the first stages. So the Navajo Nation does have a very good public information office and has been able to create longstanding relationships with huge media outlets. And I think, we as a nation did not reach out to media coverage just for our people, but I think that we ultimately helped shine light onto a bunch of deficits across Indian country. I was on another panel about data collection for COVID-19, and on that panel, the Seattle Urban Indian Center mentioned how the Navajo Nation was one of the only tribes that was collecting COVID-19 data by our own caseworkers. So here on the Navajo Nation, we keep track of our own data. We publish our own data, and that's very different for every single tribe. But we were able to bring that to light through media sources and outlets, and that ultimately became a catalyst for the federal government to really take a serious look at the aid for Native American tribes. During the first CARES Act, when Congress was trying to pass that legislation and tribes were left out, we were right there next with all the other tribes trying to battle for our share of the money so that all of the tribes could be equally, the funds could be equally distributed and at a much quicker pace. I think that, the Navajo Nation works with other tribes, and that's how we work best, is with everybody else. So the media coverage is very interesting. We've had a very good relationship with the federal government. We work directly with FEMA during this time. We worked with the National Guard, and it's really a collaborative effort in this time. But it's again really just advocating for the Navajo Nation and advocating for all of the tribes in the United States.
Definitely. Thanks for that answer. That's I feel like that's true all across Indian country. We have to look out for our own communities, but also we're so much stronger together when we're advocating, especially in a time like this. So Candelaria, you're the health director for your tribe, and this pandemic at its core is a public health crisis. And so it's really tested our health systems in every community, especially in Indian country. And a lot of folks who might be listening to this panel may not be familiar with the federal government's involvement in Indian health. And so would you mind kind of describing the federal government's trust responsibility to provide healthcare in Indian country, but also how was that realized over the past year in your community, and what are some of the challenges that you faced in the healthcare space?
Thank you for that question. Definitely, yes. I think this has really, truly been a learning experience for a lot of tribal communities in terms of what that responsibility is from the federal government, and learning for ourselves, what does that mean in terms of public health? From my office, we are the public health office, and so we work in conjunction with Gila River Healthcare here to provide services to our community members and those that are tribal affiliated as well, that come and receive services here. So definitely has been a learning curve for all of us in how we work just within our own community partnerships, and then coming together as, both ladies have provided, that relationship and ensuring that that relationship is continuous. For Gila River, we have been working with with the federal government, and with mostly everyone has been working with the federal government for quite some time, but really advocating for what is needed for our own tribal communities. And I agree with what you stated, is coming together as tribal communities and tribal nations to advocate for that is even greater than ourselves. And so definitely that work has been continuous. And for our community, I think what has been unique in our situation, and I'm pretty sure with most tribal communities, is what is public health and what role do they play in tribal communities. And our department is nowhere as large as our healthcare system in terms of providing, clinical services. But as the pandemic came around, our community learned to understand what public health's role is in terms of disease surveillance and what that really entails. Because with our situation, we needed to, work together to get individuals quarantined, and that took every community member in our community to work and understand, what does that mean? What does an individual mean what does that mean for an individual who has to be placed under quarantine? And what does that mean for their families? And what does that mean for our community? And so when everyone understood how the pandemic affects an individual, and then their family, and then the community, I think that definitely helped us to come together to provide advocacy for our tribal community with the federal government, and tell them, this is what we actually need, not what you think we need, but this is actually what we need. And by everyone understanding the thresholds of a pandemic, what you can and cannot do under a pandemic, I think that helped for us to advocate for our resources here. Thank you for that question.
Thank you. Yeah, so much of this has come down to advocating at the federal level. And so tribes have a government to government relationship with the federal government. So Chairman Torres, as the chairman of her sovereign tribal nation, has this federal government to government relationship with agencies like you all mentioned, FEMA, HHS, the CDC. And so Chairman Torres, I'm just wondering, how has your relationship with the federal government, what has worked, what hasn't worked, and where are you guys right now? Because there's been a lot of new legislation passed, but I feel like things are changing all the time. So where are you guys right now?
Definitely. In terms of the federal government, I think it's always a work in progress. I think, under the new administration, we've made significant headway. We have our first Native Department of Interior, Deb Haaland, that showed that he was absolutely willing to come through with the promises that he made. We've seen a lot of Native people in the Biden administration, which is absolutely huge because it's wonderful to see people who look like us, who understand Indian country issues at that level, to be able to talk to their colleagues about exactly why consultation is so pertinent to tribes. I think the other thing that we look at is, dealing with the state, is that a lot of tribes don't have a good relationship with the state because the state feels that they don't have to honor our sovereignty. But, as we've worked through this, I think that Native people have really shown, again, their resilience, their perseverance, and that we always make do with what little we have. But it's collectively joined our voices together on exactly, like was said earlier, is what we need. And we know our tribal communities better than the federal government does. And we have to tell them exactly what it is we need. We need flexibility, and how unique we are as tribes. And so the biggest thing that I've learned from this whole thing is, I don't care whose feelings get hurt, we have to use our voice for the greater good of our people and the next 7 generations. And so, I think we've really said this year after year with Indian Health Services funding, is full funding, advanced appropriations, those types of things. Had they put those into play 20 years ago when I first started in this game, we would have been better off when this pandemic hit. We would have been more prepared to help our people. So, having those conversations and those consultations is, I'm tired of playing Mr. Nice Guy over here and saying, well, this is what I need, this is why. No, now I'm demanding it be done. And, again, with the current administration, he's pledged to make full funding and mandatory funding for Indian Health Services. That's got to happen now because our people are dying. They've died, prior to the pandemic, and now it's worse. But the biggest thing is we have to continue to use our voices and teach our young children that their voice is just as important, so they can carry on those traditions for us. So thank you for the question.
Definitely. And that actually leads me into my next question for Shondine. Part of your role as Miss Navajo Nation is also a cultural role. And so you fill this cultural space for your community, and COVID has really impacted our cultures. I remember early in the pandemic, a Native woman told me that social distancing isn't our culture. We are very social and we like to get together. And but also what that has meant as we've experienced the pandemic for over a year now, this cultural loss of losing our elders and losing languages and losing all of these, this traditional knowledge that was housed with our elders has been really detrimental to us. So Shondine, would you mind sharing with us a little bit about just how COVID has impacted the culture and what you've seen as Miss Navajo Nation?
Sure, that's an excellent perspective. I think a lot of people leave out when we're talking about COVID-19. Some of the interviews that I've had, they ask me, why do you think the Navajo Nation is so keen on taking the preventative measures on the Navajo Nation? Why is the Navajo Nation requiring mask mandates? Why do we still have curfews? Why are we taking the most drastic precautions to prevent the spread of COVID-19? Well, one, because we were the first population in the United States to have the highest per capita rate of positive cases of COVID-19. And that was very difficult for me because that the trend, it started in my home community. So my home community was affected first, and the Navajo Nation is roughly the size of West Virginia. So when COVID-19 started, it started in my home healthcare facility. I was actually scheduled for an appointment during that time that the first positive case was detected, and I fortunately that appointment was canceled. So that it happened so quickly, and I took it very personally because I was also restricted from traveling from one reservation town to another. And so that meant I was on a travel restriction, a very strict travel restriction for 3 months. And that was very difficult for me because I needed not only to harbor my personal feelings, but also to be that figure for the rest of the nation, to make sure that everybody felt that they were seen, that they were heard, that that they could trust the information that was coming from the government. So culturally, the shift in how we communicated was probably the biggest shift, and I think that was definitely highlighted in our ceremonies and highlighted through our coming of age ceremonies and so on and so forth. So the sort of communication that we had to start to rely on, which are still continuous. Actually, the president of the Navajo Nation is on his Facebook Live town hall update right now. And we do our town hall updates every Tuesday and Thursday in the morning. And relying on that communication became vital. But again, it really brought up the deficit of internet connection here on the Navajo Nation. But right now, the way that our community is continuing our traditions is through Zoom. A lot of it's through Zoom, but we also have started to consult with healthcare professionals on the safest way to conduct certain sort of ceremonies or needs in our communities. So throughout the pandemic, on our reservation, we've been able to continue some traditional ceremonies, but not the social large gatherings. We have strict mandates here on the Navajo Nation. Everybody, before you go into the grocery store, you get temperature checked. Everywhere you go, you have to wear gloves and masks still. And I know that we're in an orange state right now, but the protocols are still very, very strict here on the Navajo Nation. And it's all to protect our elders. So every time a person would interview, I would take an interview with for example, MTV. They asked me why I was so supportive of these strict mandates. Well, our elders, they are the treasures of our nation, and so they're the treasures of your nations as well, because they hold the history, the oral traditions, the songs and the stories that are not written down. And that's just our way of life, and they are the most precious parts of our culture that are present today. And I know that is the reason why we have such strict mandates here on the Navajo Nation. It's actually my platform that says that means I wanted to, before I became Miss Navajo Nation, I wanted to bridge the gap between our elders and our youth, and to make that connection. And so, even through the pandemic, I've been able to continue my platform and support our elders and our youth. It's a very, touching and deep topic to continue to talk about. And I know that the rest of our panelists can identify with that, because, we all cherish our elders in our communities.
Definitely. I'd just like to open it up to our other panelists. If there's anything in this, how COVID has impacted our culture as Native people. Candelaria or Chairman Torres, do you have anything to add?
Sure, I'll add to it. So thank you. So for us, for Gila River, some of the same challenges that Ms. Parrish spoke about, definitely we've seen here in the community as well. We did go have executive orders since March of 2020 as well. And so strict mandates on mask wearing, social distancing, no gatherings, same type of mandates here in our community that we've been following. And we've seen that it has worked for our community. The struggle though and challenges is, being able to gather without having to see our elders. You know, we can't gather, and so we can't see our elders. And so that was our first source as well, was to get network connectivity. So that was a priority for our tribe, to get that out there, not only for the elders, but for our youth as well, because they were going to school. So we had some of the same challenges with connectivity issues to the network. And that became the priority here. And so luckily it has been working. We also brought upon our Gila River Youth Council, which has been longstanding. They've been working with the elders for quite some time. So since they already had that engagement, it was just a matter of getting them into this idea of doing Zoom or WebEx, you know, different types, thinking of innovative ways to get together versus in person. And so really it was of course, you guys know, the youth are pretty much, I mean, my own children, they show me what to do. But the elders, you know, they were challenged with it a little, but because it was almost like a brother-sister relationship, showing them how to do this and get them used to it, that was the ideal situation that we learned for our community, is getting the youth and elders together, and really a learning time, you know, and engaging and learning together on how to get through the pandemic through being virtual. And so that has helped us in the community. And thankfully, you know, our elders haven't been as affected with the pandemic. And like Ms. Parrish shared, that is also our priority. And so in the very beginning of the pandemic, that's everything we did, was reaching out to the elders and informing them, going door to door, telling them, you know, about how highly contagious COVID is. And the best measure for them was staying home. We'll come to you, just please stay home, you know, trying to find out what resources do you need. And so 5% of our elders have been affected by COVID. And so we're really trying to work on keeping that at that number. I mean, we've already been impacted, but not getting more than that, you know. So that has been working for us as well. So we just really advocate for that, for the network connectivity for tribes. You know, really it'll help us in the future as well, not just here today, but in the future. Thank you.
Yeah, and I'll keep my comments brief. I just, you know, I agree with everything wholeheartedly, is that we had to learn how to modernize and step into the now, you know, with our elders, with our youth, with their distance learning. And, you know, with the CARES funding, we were fortunate to be able to buy all of our elders and all of our children laptops. And so that was a huge advantage. And we were also able to pay for internet services for them for a time frame, which was good, because they got integrated into what internet is, what they have the capability to do. And so, you know, one of our biggest things was, we hold an annual Pine Up Festival every year. And we were trying to think of, like you said, innovative ways in which we could still do something and, you know, not televise our actual blessing portion, because we know in our traditions we don't do that. But we still wanted to share the good medicine of the songs, you know, the hand drum songs and the prayers and the blessings. And we were able to pull that off, you know, and our elders got to be a part of that, you know. But I think too, the most disheartening thing that I've seen throughout this is that our non-Indians do not understand our cultures and our belief and our values and our traditions. And, you know, when the pandemic first hit back in March, we closed down our reservation, we closed down our borders, we closed our Weber Reservoir, which is a huge recreational area for the surrounding communities. And they did not respect our sovereignty. They were breaking, burning, shooting our signs down, you know, going over our barriers, trying to get into our reservation. And it was a huge eye opener, you know, about the blatant disrespect from people not understanding that, you know, we're enforcing the masks, we're enforcing social distancing, exactly for that specific fact that our elders are our most precious commodity on this reservation, and we will do whatever we have to do to make sure that they are safe and that they feel safe. And so, you know, everything's a learning curve. Everything's been a challenge thus far, but again, we've shown that we will make it through it bigger and better than before.
Yeah, that's a really good point. I think all of you have brought up in one way or another resilience and innovation in Indian country. And Native people are resilient just by nature. We can experience something that's negative and then bounce back stronger. But also, Indian country has shown the rest of the nation and the world how to really battle this on a local level. People are looking, I know even on my reservation in Northern Idaho, we are one of the leading vaccinators in the region. Non-Native people are coming to our clinic because we have an effective way to roll out the vaccine. And so I kind of wanted to turn to innovation and how we've been able to really battle this on a local level. So Candelaria, I'm wondering, how have you seen innovation within your community, especially maybe in the public health space, and what can other communities learn from what you guys have done at Gila River?
Thank you. Yeah, definitely. I think as a community, what we did initially was learning everything we could about the COVID in general and coming together. I think in the very beginning, our challenge was having our community understand COVID in general. And then from there, really working with our community and having them tell us, what is it that you need? That became first innovation in terms of reaching out, you know, really connecting with them and understanding what it is that we can do better in this pandemic. And so from that, we were able to, in terms of vaccinations, really work towards how can we get vaccinations to our community members versus them having to go wherever it is that they were going to. How can we bring that to them? So really understanding like the community partnerships, really understanding the layout of the community. So what I mean by that is going out into the community and taking a real personal look at what is it that we are, when we say we're going to provide a service, how do we actually provide it? So really learning that. And I think in that sense, it provided innovation of, well, definitely need network connectivity, definitely need mobile units in a different sense of not just a van going through the community, but an actual mobile unit that is like heavy duty utility type of vaccination mobile unit, because as you guys know, living on a reservation, it's not these nice paved roads, they're dirt roads and, you know, all different type of things that, you know, we have to be able to navigate through. And learning that mass vaccinations actually work. So we've been doing mass vaccination clinics for our community members for quite some time. And that took effort from, you know, working with our community stakeholders. And then we partnered with the National Guard to be able to do that. And so they actually have been helping us in our pod events. What has actually helped with us as well from the very beginning is we utilized the NIMS planning, which is the National Incident Management System. And we've been doing that for quite some time. So we work, we have Governor Lewis's COVID-19 task force, and we work under the NIMS planning efforts. And we do that at every pod event. And we have different experts. Our task force is made up about 40 individuals that are directors, chiefs, you know, different leaders in the community. And then we have senior advisors that actually help us and, you know, assist us with different areas that we may not be familiar in our own expertise. And they allow us to, or they provide the information to us that allow us to improve upon, or maybe things we never even thought of that they give us insight into. And so that has been working for us. And I think that that has provided innovation in how we can continue to, one, service those that are still affected by COVID, positive cases, and then vaccinations, securing one, vaccinations, and then two, continuing to provide vaccinations for our community members. Thank you.
That's great. Yeah, I'd like to turn to Chairman Torres next. How have you at Walker River Paiute Tribe innovated and moved forward? How can other small local governments learn from your example in your community?
Thank you for the question again. I think that, as small rural communities, we actually had an advantage for once, because I can say that IHS finally came through and made sure to get the vaccinations out in a very timely manner and made sure that we had more than an adequate amount. And so we were able to get into tier 1 and tier 2 quite quickly. I think the biggest hindrance has been there is still a lot of historical trauma of vaccinations passed out by the federal government to our people. The other one is that there's just simply not enough data behind it to talk about long-term effects at this point. But I think the biggest thing is we have done an amazing job on a daily basis since it started of continuing to test, monitor, and roll out the vaccinations as fast as we could, making sure that everybody's getting them from our elders. We went out to their homes to give them to the homebound, just making sure that everybody has exactly what they need. And so, like I said, we were close to even our tribal members that live off the reservation for some time, and, to make sure that nobody was bringing anything in. But we actually opened up during the holidays again, so that people would be able to see their loved ones, because we noticed the altered mental health of our elders in not seeing their family for some time. But we were actually doing a better job as small rurals than the urban areas in the cities were. They were falling behind as far as their schedule and getting the vaccination out. So we have been bringing our tribal members home, and also bringing anybody at this point who wants it to our reservation to get it and then get out. But no, at least just making sure that everybody's vaccinated so that everybody can hopefully see that light at the end of the tunnel and maybe go back to what's considered the new normal.
Wow, yeah, that's such a good point. We all need to have that light at the end of the tunnel that we can kind of look towards. And that perfectly brings me to Shondine. When we think about innovation and these ways that we're all learning and adapting, I've never spent this much time on Zoom before, but what have you seen with youth in your community and just maybe across the country about how are youth, Native youth in particular, finding new innovative ways to handle this pandemic?
Yeah, great point. Well, I think that, I just saw a commercial for TikTok and there was a Native American influencer on there. So I think that our youth in this generation are taking advantage of being seen and being heard. And that's exactly what the future of our Native American populations need. I think that, for the longest time, we've always just been stuck at that 1%, being told that you're just 1% of the population of the United States. But our Native youth, they're accumulating 1.8 million views per TikTok all the time. So I think that our Native youth are rising to the occasion. They are naturally taking their creative stance on the situation. And, it doesn't have to be creating art. They're teaching other people about their food, about their clothes, about what's culturally appropriate, how to speak to one another. And I think that our youth also deserve that credit. And during this time to really educate the modern society of what Native Americans look like today. Not stuck in history books, we're not stuck in the past. And our youth are doing a tremendous job at advocating for the future of our people. We just had a young lady from the Navajo Nation skateboarding on the sandstone rocks all over the Navajo reservation. And, you know, she was in her traditional regalia on a skateboard in the middle of nowhere. And, you know, that's in Arizona. And I think that the average citizen in Arizona would have never thought that that's what Navajo kids do when they're herding sheep, when they're trying to help their grandparents. So, you know, our Native youth are I think the innovators of this this time, and they're doing a great job, you know, and they are really taking a look at science. Here on the Navajo Nation, we have great scientists that come on our town halls and speak just, you know, the science behind everything, and that really helps our people understand, and our youth are able to then translate that and make it more feasible and understandable to the average citizen. So, you know, I think that in my position as this Navajo Nation, I've used plenty of my social media platforms, and in turn, you know, really helped. I hope that I've helped our youth to really focus in on the needs and topics that are current to helping our people.
Great. I think that, as you know, we are seeing that light at the end of the tunnel now with the vaccine distribution, and rates are finally going down after almost a year of never seeing that. And so it has me thinking about the future a little bit. And I'm wondering from our panelists, what do you all see happening in the future, and how are we going to emerge from the pandemic a little different? So Chairman Torres, I'd like to start with you. How will you and your community emerge from this pandemic different in the future?
You know, I can definitely say with the CARES funding that had come down before, and also the American Rescue Plan funding that's coming down, is Indian country may finally start to be whole. You know, and I think the biggest thing is that they see the actual need for infrastructure, for housing, for, you know, the things that we have huge issues and need more funding for all of these programs that we run on a daily basis. And, you know, with the ability to have that kind of funding to make these things happen finally, I'm very excited for the future of Indian country. You know, we may be able to leave that footprint for the next 7 generations to pick up and hit the ground running. And, you know, I'm very excited that, you know, the vaccination is coming out, and that we, you know, I don't foresee this going away. That's my biggest thing, is we need to plan for this going forward. But we've gotten a lot of education over the last year, a lot of challenges, a lot of experiences. And we're going to be, like I said before, that much better going forward. We're going to be prepared. We're going to have our voice at the table, at every table now, you know, from EIA to Interior to IHS. You know, we actually, our voices matter. And we've seen that with the voting that we changed this year, and everything that we're asked to be involved in now, because our perspective absolutely matters. And so I just think, you know, the future of Indian country is going to be phenomenal. And I just see, you know, after this 4 years is over, I see a Native president, a woman. But, you know, I see so many good things for Indian country overall. Like I said, with the funding, with the voices at the table, with our perspective, they need that, you know, and we definitely bring a lot.
Thank you. Thank you for that. Candelarian, what do you see happening in the future in your community at Gila River?
Thank you. Definitely agree with everything Chairwoman Torres stated a few minutes ago. I believe with more funding and continued funding that we can, as a community, continue to progress. What the pandemic has shown us during this time is the ability for us to telework as a tribal government. Prior to that, we really didn't know, right? We were trying to figure things out at the very beginning, trying to gain our footing here. But within a couple of months, I'm just amazed at our workforce and the ability that they were able to do this under a pandemic, you know, telework, especially our first responders, the response that they provided to our community, amazing work that they do every day. But with the community in general, just what they're able to do under a pandemic, you know, continuing to stay connected with their family, because that takes effort on their part, you know, to teleconference or do WebEx and things like that. We know now that we're capable of doing that. So in our government, we're actually thinking of this hybrid scenario that we will continue to do, because as Chairwoman Torres stated, you know, we don't think, or we know COVID's not going to go away here. We're going to have to learn to live through it. And so that's one of our efforts that we're working on now, is how do we continue with working? And because we may have to go through these phases of these ups and downs of COVID, we may have like this decline in positive cases, then we may have a surge again where we go back to closures, different things. And so for our community, you know, I think through this whole pandemic, it has definitely taught us some positive things in how, you know, strengthening our community and just knowing what we can all do. Our response to this pandemic has been eye-opening for us all, I believe, and what we can do. So definitely, I do agree. I think it's positive. You know, we have learned to live in it, and we will continue to be resilient. Thank you.
Great, and thank you for that. And Shondine, as you look to the future, and as a Native youth, what do you see, how do you see Indian country and your nation moving forward after this? What's in store?
Sure, great question. Well, I know here on the Navajo Nation, one of the slogans that our president and vice president say, no matter what's going on, is buy Navajo, buy local. And I used to think that it was mundane, that they overstated and things like that. But what the message behind that is that you know, you can decide what you're going to do next. And you know, in that is a strong message of resilience, strength, and also a plan to continue. And you know, I think that our youth have really taken that personally, and have not only looked to how they can help right now, but what can they invest in, what can we continue to move forward in. And you know, with the connectivity and seeing the deficits that we have and what we lack, it is a definite eye-opener to our youth in our communities. I mean, personally, for me, I've been applying to master's in business administration programs. So this has inspired me and really showed me what we lack in economic development here on our reservation. And I've been very fortunate to see the insides of our government and really identify where we're lacking and what we need to get there. So I think that our youth have been very keen and very aware of these situations that we're in. You know, the Navajo Nation here on our reservation, we're so large, and both of you, you are all so fortunate to go door to door and take care of your community so well here on the Navajo Nation. I don't know if we could, you know, afford to do that for every single member that we have, but you know, by supporting what we our healthcare initiatives, you know, that's how we're taking care of one another. But you know, just really trying to capture that imagination at this time, and really to continue to encourage our youth to move forward and not to let this stop us, but to continue to persevere, because that's what our ancestors did. We continue to share about the past traumas of our nation, and we say, okay, well, our grandparents, they overcame these different pandemics and these situations without internet, without electricity, without running water, and they made us who we are today. So you know, we're just trying to make the most of what we have, and really trying to move forward. I think the Navajo Nation's biggest move right now is in infrastructure. We are still there's still 40% of our population who don't have electricity. So a lot of our CARES Act funding goes into that infrastructure cost, and we're extending power lines, we're extending broadband and broadband. We're also we're in a new phase where, you know, everybody's talking about the new relief fund, and in that we have proposed water extensions, because even though here on the Navajo, my grandparents don't have running water, so what they have to do for their drinking water is they go to the local windmill, and the windmills, they are run by the federal government, who don't test the water. So you know, that very direct deficit, I think that not only I see, but all of our youth, that's how we all grow up. And I think that now more than ever, that they realize that these are things that are needed today. So you know, our youth are very creative, and I know the youth on your reservations are very creative, and they can see through, you know, Instagram or Facebook what our leaders are going through and what our nation is going through together. And I know I'm very hopeful for the future. So I'm excited to see what's next.
Just hearing you makes me hopeful for the future. I'd like to provide our panelists with just a minute or two to offer any closing remarks or anything that you want our audience to know or hear before we close out. So we'll go to Chairman Torres, and then to Candelaria, and then to Shondine.
Yes, so again, thank you for the opportunity to join, you know, these wonderful ladies this morning, and yourself for an excellent job. I think, again, it's just always remembering the hands that raised you, and remembering who we work for and the next 7 generations. The thing is just to stay as community, always fight for your people, but not only your own people, all Native people. And the biggest thing is we will get through this. You know, we will persevere, we will continue to be resilient, and we will continue to lead the way. So just be safe, and that's what I have to say. So thank you so much. I appreciate the time today.
Thank you, Chairman Torres. Candelaria?
Yes, thank you. I just want to thank you all for having me. It was really nice to hear Ms. Parrish and Chairwoman Torres and the work that they are doing. It's really learning from each other, and I'm just thankful and honored to be on this panel with everyone. And again, you know, just advocating the same thing that Chairwoman Torres stated, is working together. I mean, as tribal communities, definitely working together, we have a louder voice. We can gain so much strength, and definitely can continue to beat this pandemic. I know some of us tribal communities have been hit very hard during this time, but definitely coming together, learning from each other has helped us all. So continue to do so, continue to take care of yourself. Very important for us all to take care of ourselves during this time, because if we can't take care of ourselves, we can't take care of others. So please continue to do so. Take care and be safe out there.
Thank you for those words. Shondine?
Sure. Well, thank you for the invitation to be here today. It is always a very humbling experience when I receive an invitation to share the experience of the Navajo Nation. It has been such a very trying year. It has been one of the most challenging, you know, situations in not only my life, but everybody's lives. But we had a candlelight vigil 2 weeks ago, and we lit 1,222 candles to symbolize all of the lives that have been lost on the Navajo Nation. And you know, every day when you're working with your government, when you're working for your people, you keep working, you know, you keep your head down, you keep treading. But the moment that I looked up and I realized the lives that had been lost, and thinking about all of the people that have had COVID-19, there is not one person on our reservation and, across America that has been impacted by COVID-19. So my prayers and my heart go out to all of the families that have been directly impacted by the pandemic. My heart and prayers go out to those that are still, trying to recover from the symptoms, and, financially, everybody, it has changed the way that we view our livelihood. And I hope that you all continue to draw close to your families, to your culture, to your way of life, so that it may continue. This is a very a life-changing time in I would have never expected to have been Miss Navajo Nation. And I just hope that I did, did the best that I could during this time. But again, I'm very thankful to be here with all of you. I know in your capacities that you all feel the same way and that you all have led the same way. So thank you so much to the service to your communities and really being a representative for all tribal nations in your states and your local areas. So thank you so much for having me today. I'm very, very honored to be here today. And thank you.
Wow, thank you all so much for joining this panel. This has been the highlight of my day, probably the highlight of my week, to just listen to all the incredible work that you all have been doing to help support your communities through, like you all have said, the toughest year that I've been aware of, that I've lived through. So just thank you all for the amazing work that you're doing in your communities, and thank you for sharing that with us today. And I'd also like to thank all of the viewers who are watching this, and we definitely appreciate anyone who wants to spend some time with us on this all-female Native woman panel. It's just so great to see you all, and just really appreciate you, and thank you for the work that you do and the work that you carry. So Lem Lunch, everyone, thank you so much for joining us today. And with that, I'll turn it back over.